Hello once again, and welcome to Clinic Annex with Dr. Abosede Adegbite. We will talk about the pulse today, that vital sign that gives us a glimpse of what is happening in our hearts and other parts of our body, even without doing sophisticated tests. What is the pulse? It is that burst or throbbing feeling that you feel in the arteries when blood is propelled through them. It tells us about how many times the heart beats. Each time you feel a pulse, the heart just beats. So how can you take your pulse? First of all, you can use electronic means to check your pulse. If you check your blood pressure with your BP monitor, it usually displays 3 values. The first and the second are the systolic and diastolic blood pressure values. The last one, the third one at the bottom, is your pulse, and it tells you the rate, not any other information other than the rate. You can also use a pulse oximeter to check your pulse. One of the 2 values in the pulse oximeter display is your pulse, but you can check it manually. The best place to check is either the wrist or the neck. So let's see how to check it. You go trace the thumb down to the groove at the base of the thumb. You use 3 fingers to press, and you will feel that burst, rhythmically coming, throbbing. That is the pulse. You will now count for 30 seconds and multiply by 2. That is your pulse rate per minute, and that is the amount of times your heart has beaten in 1 minute. You can also check it in your neck, about 2 centimeters on 1 inch from the midline. You will see a groove. Yes. So if you press it, you will say pulsation. That is your pulse. You cannot press the 2 at a time. You will feel dizzy. So it is 1 per time. You can check on either side of the neck. That is your pulse. And you can check, especially for somebody that has collapsed. If somebody collapses now and you want to check whether they have a pulse, those are the 2 places you can check. Now, what are the deviations from normal and what is normal? Well, the very first thing is that the normal rate is 60 to 100. 60 to 100 beats per minute. If you are at rest, if you have just done exercise, or you have just climbed a flight of stairs, or you are nervous, you are scared, then you can have a higher rate, which will return back to normal when you have rested. But when the heart rate is higher than 100, when you are at rest, then we need to ask questions. One of the causes is heart failure. In heart failure, the heart is weak and cannot pump blood to meet the oxygen demand of that person. So it is pumping little per time. And because the heart is still striving to meet the need of that person, that is why it may pump more than 100 times in heart failure. It is like somebody who is carrying building blocks and he has energy to carry 1 per time and he needs to carry 100. He will have to make 100 trips, right? But if that person is energetic and can carry 2 per time, that person will make 50 trips. It is the same that is happening with the heart. And when somebody has anemia, shortage of blood, the red cells that are carrying oxygen are fewer than normal. That means that to meet the oxygen demand of that person, the heart will have to pump more times than usual. So in anemia, the heart rate is also higher. Other causes are medications. For example, those that asthmatic patients take, or hyperfunctioning of the thyroid gland, or dehydration. People that have been fasting for up to 100 days, or people that, and they are not drinking enough water, or people that have started losing fluid, maybe because of stooling or vomiting. They can actually become dehydrated suddenly and their pulse will be higher. People that are on stimulants, caffeine, they're always taking coffee or energy drinks, yes, in them too, the pulse can be higher. Or those that have infection or severe pain or high body temperature or electrolyte imbalance, when sodium is too much in the system and they are retaining fluid, all of this can cause increased heart rate. What if the heart rate is less than 60? Well, it is normal in people that do endurance sports, people that are very highly active physically. For example, footballers, you see that they can run for 90 minutes without getting tired. These people can have less than 60 beats per minute, and it is Okay, because they have trained their hearts to deliver large amounts of blood per time to the body because of their increased oxygen demand. So the heart does not need to pump too many times to give them what they need. And that's why they don't get easily tired. But what are the other causes? Number one is aging. People that are 65 years and older, over the years, there might be damage to their heart, and it can happen in them. They might have what we call heart block. Heart block is in different degrees, first, second, and third degree. And that spells different degrees of deviation from normal. So in first degree, you may count 55, 56, 50 something. But when it is getting to second and third degree, you are counting 40 something, 30 something, then it is really serious. They need to see a doctor. Other causes include hypofunctioning of the thyroid, under activity of the thyroid, which is hypothyroidism. Or if somebody is on medications like beta blocker or opioids. Some of our hypertensive patients are on beta blockers. Or if somebody is on recreational drugs, all those illicit drugs, or they smoke, this can happen. It can also happen in severely low body temperature, hypothermia, or electrolyte imbalance, where a person has excess potassium or calcium in their body, or if somebody has head injury with increased pressure in the skull, that is clearly an emergency. So what are the other deviations from normal aside from the rate? We have talked about the rate. It can also be regularity. If you feel the pulse and it is supposed to be regular, coming steadily, but if it stops, then starts again and does that repeatedly, that is abnormal. But if it is just one missed beat, fine, no problem. But you are getting missed beats regularly, that is abnormal. Or the pulse is weak, it is hardly palpable. You can't even be sure that you are getting a pulse. That is also abnormal, and it can happen in quite a number of the conditions that we have mentioned. Now, what are the red flags that should make you present to a doctor very, very early? One of them is when it is irregular and when it is weak. You should consider seeing a doctor early. Or if you have dizziness, fainting attacks, or the person is just fatigued, very weak, or you have chest pain, or you feel like there's irregular heartbeat, these are the reasons you should present yourself to a doctor. Thanks for watching. I hope it helped. Now that you know how to take your pulse, why not quickly take it for 60 seconds? But if you take it for 30 seconds, multiply it by 2. After taking it, check whether it is normal in terms of rate, rhythm, that's consistency, regularity, and in terms of volume. If it is weak, please let a doctor know. I'll see you in my next video. Until then, please remember, good health is great wealth. Keep yourself safe. Bye for now.